Welcome. Thanks for taking a few minutes to view this short presentation of Montana's state-designated health information exchange called Big Sky Care Connect, or BSCC. My name is Jeanette Polachek, and I'm one of the clinical analysts on the Big Sky team. I'll be conducting this demonstration on our live environment so you can see exactly how the solution works. But the patient record we review is completely made up. No actual patient data will be displayed. We'll start the demo on the BSCC login page. I am using my Big Sky user account to log into the solution, but there are other ways to gain access. One way we strongly encourage you to investigate is connecting to Big Sky automatically through your electronic medical record using what's called single sign-on technology. Further information about this technology can be found on the Big Sky website. For this demonstration, I'm logging in as a clinician with access to the full patient record, including sensitive data. We also have user roles for clinicians with limited access, support staff, and payers. Once I log in, I land on the patient search screen. Patient search allows users to find patients in two ways, using a medical record number and the associated facility, or by patient name. When searching by patient name, it's best to add additional demographic information such as date of birth or address to narrow my search results. I am going to search by medical record number and associated facility. Once I enter the search criteria and click search, the patient search results screen is displayed with my results. Because I search by MRN, I get an exact match. You can see the weighted match is 1,000, indicating an exact match. Now, before I open the patient's record, I take note of the message. Some records have been filtered due to consent. This message indicates that the patient's record contains 42 CFR data, and I need to break the privacy seal in order for this information to display when the record is open. Users who do not have sensitive data access will not see this warning and cannot break the privacy seal. To do that, I use this back to patient search breadcrumb located in the top left corner of the screen. Notice my search criteria is still displayed. To break the privacy seal, I check this override box and enter the required information. If I'm not getting authorization directly from the patient, I can enter the person that is. I also enter the reason. So I'll put in patient care and the authorization type. This information I enter is captured in an audit log, and the audit logs are reviewed by the participant privacy officers. Once I enter the required information, I click search and come back to the patient search results screen. Notice the consent message no longer displays. One other feature to note before opening the record is if I click on this arrow, I am shown the complete list of all the medical record numbers associated with this patient and icons indicating what data is available from the facilities who are associated with those medical record numbers. I can click on any icon and a legend appears that describes the meaning of each icon. For David, we see his record contains most all of the data types you will find in a Big Sky patient record. Okay, let's open the patient's record by clicking on the top entry. Be sure to click the top one to open the full record. If you click on any of the additional MRN line items, then the record will just display data from that facility. The Big Sky patient record is laid out in a format that is similar to a typical electronic medical record. The header contains basic demographic information. In this case, a banner is displayed containing information on 42 CFR data usage, and it's displayed only because I broke the privacy seal. There are icons located in the far right corner indicating additional information about this patient. In this case, I see the patient has allergies and some additional information on demographics. The legend also provides shortcuts to the corresponding sections in the record. For example, I can get to the patient's allergies by clicking on this link. Notice there is a sensitive data button. Because I'm a clinician with sensitive data access, I can use this button to break the privacy seal on data that is protected under Montana law. This law covers all HIV and STD information. I entered the same information as before. And once accepted, this data is displayed in the patient record. Notice too, the banner now displays additional wording on Montana law. Users who do not have sensitive data access will not see this banner or the button when they open this patient's record. One final note about sensitive data before we move on. BSCC defines a third set of patient data as confidential. Confidential data is sent from non-42 CFR facilities, include substance abuse disorder, mental and behavioral health, reproductive health, and social abuse data. Users do not have to break the privacy seal to view confidential data. Their access is granted based on their user role. Along the left side is what's called the chart navigation tool. You can quickly navigate to any section of the record by clicking on the section name. The blue bar next to any section indicates that data is available in that section. The record opens to the patient summary. The clinical summary has 6 sections that display the 5 most recent entries for each data type: diagnosis, lab results, allergies, diagnostics, medications, and documents. You can use this section to get a quick overview of the latest information on the patient. Each of the sections is laid out in a similar way. Let's take a look at medications. There are 2 subsections, current and historic medications. A current medication is defined as any medication that has been prescribed or refilled within the last 90 days, and this patient has none. Within each section, I can search using this free text search field, and I can sort using these options. For example, with medications, I can do a primary sort on medication and a secondary sort on date to get a good indication of the fill history for a particular medication. Anytime I see 3 dots or ellipses, I can click on them to display additional information. Here I see additional information about this prescription. I can see the ordering provider, the pharmacy, and the SIG associated with this prescription. We use the back 2 breadcrumb button in the top left corner to navigate back to the main section. As of January 2020, Big Sky has started receiving claims data for Medicaid. We extract only clinically relevant data to display in the patient's record, and that includes medications, diagnoses, procedures, and services. Let's take a look at procedures and services. You can see that there are filters at the top of the section that allows me to see only data from clinical sources, only data from claims, and then all of the data. And we have the same filters for diagnoses. We receive a variety of clinical documents from participating organizations. Most of these documents are found under Documents. You see a list of the available documents and a link to the full report. We currently receive a variety of transcribed documents, such as visit notes and discharge summaries, as well as continuity of care documents from participating organizations. Big Sky also receives imaging reports from several facilities. These are located under diagnostic studies. Again, I see a list of the available reports and a link to the full document. As an aside, Big Sky has just signed with an imaging exchange vendor. Once the solution is implemented, we will receive the images that correspond to these reports. Lab results are presented in 2 different ways. I find the view by date, this top view, to be the easiest to navigate. I have a list of the lab tests and the dates and times of available results. I can click on the date and time to get the full details of that test. When I have more than one result, I can click on the big C to get a cumulative view. I can also click on the link, on the graph link, to plot values to get a visual representation. Now to quickly get back to the main page, I select Chart Book from the drop-down menu here on this breadcrumb, and it brings us back to where we started. Okay, a couple of other sections. We also have a list of encounters that includes inpatient admissions, ED visits, and outpatient appointments, and a section on demographics. The last section I'll cover is the patient summary report. We get there by clicking on the ellipses icon in the top right corner of the screen and then clicking on Access Summary. This section is used to generate a summary that includes most of the data contained in the Big Sky patient record. I say mostly because some sections of the report are not included. Clinical documents are one major example. The summary can be reviewed in a variety of formats, and I have the option to generate the basic summary or an expanded view. Expanded version includes some additional sections, such as a list of the clinical documents we have for this patient, but it's just a list. The contents of each report are not included. If you have direct secure messaging linked to your Big Sky account, then you are able to send this summary to any other colleague with a DSM account using the send button here. If you don't, you can still download the summary and then send via whatever secure messaging platform you use. Either way, I have the ability to customize the report. For example, I can limit the date included to just the past year and select only a few encounters to make the report much more manageable to read. That concludes our demonstration. Please visit our website at mtbscc.org or contact our office. Thanks again for taking the time to learn about Big Sky, and we look forward to working with you to provide the best possible care for all Montanans.